hear that. And we have a special guest today. We have Mary Dreyer, who is our lead nurse and has been taking care of me for a long time. And so we're going to just jump right into it. Mary, thank you for being here.
Thank you for having me.
That's great. Mary, you're our lead nurse. How long have you been a cosmetic nurse?
Well, I've been working with you for 18 years. I know, I don't look old enough, but I am. And then before that...
You know a guy, right?
I know a guy, yes.
Okay, good.
And before that, I have 8 years experience with dermatology. So.
Okay, so we were lucky to lure you away from the dermatology world and into the world of cosmetic surgery. That's fantastic. And, you know, one thing that I love about having you be with us, Mary, and we said we've been together for 18 years, and you're our lead nurse, our lead injector, is what I believe really separates you from all the other nurse injectors and even doctor injectors that I see in social media and all is just your desire to continually educate yourself. For instance, conferences. You know, I don't know of a lot of people who go to conferences as often as we do. How many conferences, you know, what type of conferences do you go to?
Well, any one that you invite me to,
Okay.
I will go. I am
Okay.
a student by heart, for sure. Two of the primary ones that we go to is the California Academy of Cosmetic Surgeons, which is one of my favorites. It's one of the smaller ones, and I feel like it's more intimate. So that's one of my favorites. As
Okay,
you know, we've
right.
talked about this. And then the American Academy of Cosmetic Surgeons, which is bigger, which is a great one as well.
Right. And we've gone to some smaller ones, like the American Society of Cosmetic Physicians,
Yep.
and I know with your derm history, the late Dr. Moy down in
Yes.
Southern California, we really miss him, but there were some great cosmetic derm meetings that we've gone to as well, so I think that's really important. We can be teachers, but we're always a student, right?
Always a student, and I know you teased me when I first started. I made binders of every different procedure that we did, and you know, kept notes on everything. That's just the way I like to do it.
And even though I teased you, I really appreciated it, and that's why, as I've said, you've been our lead nurse for 18 years. So why do you stay? Why are you with us for 18 years?
Well, who wouldn't want to work with Dr. Walter Tom?
Okay.
We have great patients that come to see us. That is one thing. We just really have some really great people that I get to take care of. It's a real positive for me. I love that I get to work so closely with you and having your expertise, and we can confer about patients or procedures or what we're going to do. So I love that, and you're a great teacher, of course.
Okay.
So that works because I love to learn. So those are the things. I love that you're in-house too. I'm not one of those injectors that wants to run off on my own. I love that I always have your support. If there's an issue or I have a question, you're very open to supporting me. So I love that.
Well, thank you for saying, you know, a few of the things that you had mentioned, and I appreciate that, Mary. I do know that I asked a patient once about why does she come to us, and one of her comments was, well, you're a doctor's office. Mm-hmm. And it struck me because certainly we see a lot of, you know, with the med spas and so forth, and a lot of times there's not even a physician on you know, in the house, if you will, to help with decision making, because, you know, none of us is an island unto ourselves, and that we really need to bounce questions off of each other. I come to you asking your opinion often. I absolutely do, and I value that. We go to the California Academy of Cosmetic Surgery meeting. We have multiple nurse speakers, nurse practitioner speakers, physician assistants, because education really shouldn't have boundaries. We should be learning from each other. And it's just interesting that this particular patient made a comment that, well, your doctor's office. And so what I think that had to do with is trust, knowing that we still, even though we're cosmetic and we love the aesthetics of the world, that we still look at people as a doctor-nurse to patient relationship, and that's important. And I like your first comment about the patients. That the first thing that you said is about how much you really like your patients, and you and I have kind of talked about this often, that if we had a superpower, I would say that would be creating community. That we like to create community, and we consider our patients part of our community. So that's fantastic. So thank you for being here.
Thank you.
So now you have been taken care of patients for 18 years, and we see trends. What seems to be sort of the demand or the concern or the pain of patients coming in to see us now for non-surgical cosmetic procedures that you do?
Well, I think we're seeing a lot of people that have had rapid or a large weight loss. So it's showing in their faces. They'll come into consult and say, my face is melting or my face is drooping. So I feel like I'm seeing more of that now.
Okay, so and so if you're kind of even listening in just the news, it's called the Ozempic face, right? And so the GLP-1s, which really are a potential diabetic medication, are helping people with weight loss, and certainly for people where weight is a health issue, and it is a health issue. It has perform miracles for some of these patients, but they then get frustrated, and so their frustration is what?
Feeling like they look tired or that they're just deflated.
Okay.
Yeah.
Is there any particular area of the face that they come in and they say, you know, Mary, God, I've lost 50 pounds, but boy, I look like I've aged 10 years. You know,
Right.
What are some of their complaints, you know, specifically on the face?
Usually the lower face, the cheeks, the jowls, that's what they notice. I like to approach things, as we've talked about before, more globally, and I'll point out the temples and some other areas. But I think what most people see is the cheeks and the jowls.
Right. Always interesting that when we pick topic to talk about here at KSRO Ask the Expert, that we have a patient that walks in, and she's probably driving home to Fort Bragg right now. One of our patients, we can't mention her name, of course, but hi, our lovely patient from Fort Bragg, and my God, she walks in and, you know, she's just super buff. She and her husband, they're great, and I think she said she has to get a life. I think she's in the gym all the time, so not so much doing GLP-1s or the Ozempic face, but just, oh my God, I was so jealous. I had waist envy. I mean, I was looking at, I'm a 70-year-old dude with my waist, and I'm looking at this, you know, and she's only a couple decades younger than me, but she's in great shape. But her pain, as she came in to see me, was that she felt that she was looking, I'm going to say, gaunt or tired. Maybe even, and she didn't maybe use that word haggard, but just sort of, just rough. Her comment was that, you know, I look in the mirror and I feel like I look rough. And we can certainly see that for those who work out in the gym, and I do, that sometimes people who, as we age, who are in the best shape, you know, and you see them from the backside, they go, and you're kind of jealous and go, wow, I'd like to, you know, look like that. And they kind of turn around and they do look older than their age. And so that was some of her concerns. And her concern was looking tired. Under her eyes and her cheek area were her biggest concern. We had communicated, she's been a patient of ours for a long time. I know you've taken care of her as well. And so she came on down for us to help her with those concerns. So looking at patients with facial deflation, Ozempic face, or people are just super buffed, or some people are just genetically like that. You know, what can we offer for these patients?
Well, it really revolves around replacing that volume that they've lost. So volume replacement. And we have several different things that we like to use. One of my favorites is Sculptra. Sculptra we've been using for years. It's been around for years. It's a biostimulatory, which is very nice. So it just stimulates your body to produce its own product and can give you some fullness to the face, as well as improving the skin.
Yes. So what is Sculpt? You said it's a biostimulatory. Can you okay, we're going to be education.
Oh, we're geeky.
We're going to get geeky. Okay. So what is Sculptra?
It's poly-L-lactic acid.
Okay.
It does stimulate your body to produce collagen around it. So it goes away, you get your collagen. Exactly.
And many times I'll explain that it's similar to absorbable sutures that I have used for 40 years.
Yes.
And so back in my general vascular transplant days, might close up the abdomen or take bowel out and hook it back up or whatever I'm doing. If it's absorbable, why doesn't it just fall apart after 3 months? What happens is that it stimulates our fibroblasts to lay down collagen to connect the tissues that I'm approximating when I'm suturing. And it's interesting that as we brought this up, and you like Sculptra, that they recently have done some studies where they've done biopsies of the skin where patients have received Sculptra, and what they have found is that there's a stimulation of stem cells for improved fat cells, okay, which is important. So, you know, when here we are talking about, well, I don't want so much fat around my belly, and I certainly don't, but having a nice fine layer of fat around our face is not only more youthful looking, but it's also healthy for us. Our skin is healthier with that cushion with the fine layer of fat underneath that. So that was really a nice finding, that it's more than just collagen now that we're finding. So tell us a little bit about, if you would, Mary, how do you explain it to the patient? You know, what should be their expectations, and then what's the treatment like?
For Sculptra specifically?
For Sculptra specifically.
I tell them that they can expect a gentle fullness to their face. So it's not like really placing in one area. It's more of a global fullness to the skin, which is really nice.
Okay.
It works really well for the lower face or the temples, which is a big plus. So I tell them that we're going to do the injections. They'll need more than one session generally. We'll discuss that at their consult, and as we go along too, I'm kind of adjusting the game plan as we go, but they understand they probably need more sessions than just one.
So let's take a Gen Xer. So I can't believe the Gen Xers are 45 to almost 60. So you know, how many sessions might they anticipate on general?
Probably 2 to 3.
2 to 3.
2 to
Okay.
3.
And so then the millennials, maybe a treatment or two.
Right.
Okay. And how about us old boomers?
Well, if we haven't been doing anything, you're going to need a few.
Okay. So
Yes.
3, maybe 4,
3, maybe
4
4.
treatments.
Yes.
Okay.
Yeah.
That's interesting. When I describe Sculptra to our patients, Mary, sometimes I feel like I've got to really create trust, because you're telling somebody, we're going to put this solution in your face, you're going to like it, your face is going to be fuller, and then in about 24 to 36 hours, it's all going to absorb, and you're going to wonder, why did I pay Dr. Tom or Mary for this treatment? And then we're telling them in 2 to 3 months, collagen is going to start to build, and it's going to build up, right? And you feel like you're selling blue sky.
Yeah, you're waiting for Santa to come.
Exactly. And so, you know, hopefully we've been busy, and thank you, Jeff, for mentioning we've been voted for the 11th year in a row Best Cosmetic Surgeon in Surgery Office in Sonoma County for the Press Democrat. But that because of our experience now, I know it's absolutely true. I just saw a colleague of mine that I've been taking care of in my age group, and we've been treating her, and again, she's just one of those people who I think is genetically slender. I just saw her today, and works out and everything. So she's in great shape, but especially in women who are thinner as they get older, they can look frail or fragile in the face. And we were looking at her, and she asked me, you know, is there something you might recommend? We were just doing Botox on her today, but she asked me, is there anything else that you can think of, filler or anything else that I might get my best benefit from? And I took some more photos of her. We looked at it compared to the previous, and I have to tell you that I was really pleasantly surprised that she had this nice, healthy fullness, not weird, you know, Hollywood fullness, but she had this nice fullness. And I actually told her that I don't think we need to do anything for a year or so. Let's just see how you are, and then if you feel like you're looking deflated, we can treat you again. And Sculptra absolutely was part of her regimen, and she was a nice responder, and that we didn't do as many sessions as I thought she might have. So Sculptra, you think, is great?
I love Sculptra, and I think it lasts longer than we first initially would think. Having had patients now for 5, 10, 15 years, I think it really has a nice effect and a long effect.
I would agree with that. And we had then a young lady. She looks younger than she is, but we had a young lady, and this particular patient, yoga instructor and so forth. You know who I'm talking about. And she. I came in and just to chat with her, because sometimes I joke and I say I'm like the husband maitre d' at a Chinese restaurant. You know, I'm coming in and saying hi to everybody, and you know, and then the wife's in the back counting the money and running the show, right? But but that I had an opportunity just to see her, and I walked in and said, "Wow, you look great." And you and I discussed it afterwards, and you had mentioned that she had the Sculptra glow. Can you describe that a little bit more for our listeners?
The Sculptra glow, it just makes the skin where you treated just look glowy. It's amazing. It just looks more vibrant.
Right.
Yeah.
Right.
Yeah.
And I think for those who maybe are taking GLP-1s or Ozempic and you're losing weight and you're looking at yourself and maybe getting a little discouraged about, how you're looking in the mirror, is that the skin begins to not look as healthy either with the deflation and the absorption of the fat layer underneath the skin of your face. So Sculptra's great. I absolutely agree. I think if you're noticing that kind of deflation, it's a nice subtle but significant improvement. It looks super natural, which is absolutely the way that's our philosophy, but now is very much in vogue, the natural look. And so for patients who come in and we have Sculptra, still one of the issues that can persist is a concern about the hollow under the eyes, or they feel like they're looking tired. What would you recommend for those patients?
I think one of our go-tos is something called Easy Gel, similar to platelet-rich plasma, but it's formed into a gel.
Okay, so Easy PRF Gel, I think is the full name, and so can you just maybe in a minute or so, just sort of, I'm asking you as the expert, and as you said, getting geeky, what is PRP, PRF, and then we can talk about the gel portion.
PRP, platelet-rich plasma, so we do a blood draw, spin out the red cells, and you're left with the plasma, which is rich with plasma with the PRF.
And I call that, by the way, the paramedics of the body. It goes and repairs areas that are injured, and when we do it aesthetically, it can actually help to enhance the cells in the area that we inject it.
Correct. Right. Okay. And then the PRF is more with the fibrin, which creates a slower release of all the magic that happens with those.
With PRP, okay. And so we then progressed as you and I introduced these treatments to our office and to our patients, that we went from PRP to PRF, and now, so what is Easy PRF Gel?
So gel is a little bit of a science project where we separate the fibrin from the plasma, heat the fibrin, and then mix them back together. When you heat the fibrin portion, it creates like a gel, so it's thicker,
right?
I guess you can say, and then we mix it back together.
Great. And so, as Mary's describing, we take one syringe, we drop 2 syringes of blood, and one is cooled with the platelet-rich fibrin, and the other is warmed up, and we start to pull the protein out of it, and then we mix them together. In fact, our medical assistants who help us, I'm not sure I know how to do that, right? they're great.
I have to look at our notes.
Yeah, so Karina and Bridie, and now we have Victoria, our newest medical assistant, and they're the mad scientists, and so they're kind of mixing up the serum and so forth for us, and then we inject it. So when you inject this Easy PRF Gel under the eye, what can the patient expect in terms of the treatment itself and then the effects afterwards?
Well, we try to make everyone as comfortable as possible. There is a numbing injection, and then we try to make only 1 or 2 entry points, which helps with the comfort. And we use cannulas, which are like a squishy needle, but it's soft on the end, so they're safer in a lot of respects, in a lot of areas, and we definitely use those for under the eye area. Because all that magic is wrapped in the plasma as well, they'll look a little puffy when they leave. So I'll tell them, you're going to look a little puffy. You're not going to want to possibly go to a party or anything the rest of that day. But usually by the next morning, it seems like most patients are pretty much resolved. And then, just like Sculptra, they look just like they did before I inject them. They say, Mary, what did we do? I don't look any better. And you have to wait for the magic to happen. So you have to wait for all that collagen to be produced. Okay,
so we're waiting, and this again is another bioregenerative treatment. It stimulates our own biology to heal ourselves. I actually feel, for me, that the Easy PRF Gel, that they get more volume there than traditional PRP or PRF injections, and I believe that most patients are very, very happy with this. I know that we've been focusing on biostimulatory treatments like Sculptra and like Easy PRF Gel. Is there a place for traditional filler, Restylane, Juvederm, hyaluronic gels, if you will? Is there a place for that in patients who have facial deflation?
I'm still a huge fan of fillers. I think they have their own little niche for building certain areas more if you need more of an immediate effect, which some patients really want. They don't want to wait. So sometimes it's a combination of the two. If we're doing something like, say, building the jawline or something more structural, I think filler can be really nice for those.
Okay, so a filler is going to be more immediate effect.
Immediate effect.
Right, immediate effect. And is it, as I'm listening to you describe filler, it's more pinpoint. Like, for instance, I want to enhance the cheek a little bit more, or I want to enhance the jawline a little bit more, and the patient's wanting more of a significant improvement, that filler is the way to go still.
I agree.
Yeah. I would agree with that. And it's a combination. There's no one, anything in life, there's no one, single bullet that's going to do everything for us, right? We really need to use combination therapy. So I would agree with you that filler does have a place. Now, there is some other biostimulatory type of treatments that we can use. You had mentioned the temple areas and being hollowed out. And I just had that conversation with one of my patients this morning. What would you recommend in that area? What type of treatments would you recommend?
I still like Sculptra there. Sometimes I do filler there, but another one that I really love is Renuva.
Okay, and what is Renuva?
Renuva is a cadaver-derived acellular product, matrix, that when injected into an area, so let's say the temple, can guide your body to produce fat cells in that area.
Right. So Renuva, I'd like to, as Mary mentioned, so for you who are listening to me over the years, I want to thank you. You know that I was an organ transplant surgeon, and now I'm transplanting fat, and that's one of the things we do. But what we do is we go ahead and we use this tissue bank fat. We inject it into an area like the temples, and at first we get some volume because of what we've injected, but then it stimulates our own stem cells to produce our own fat in that area, very much like cadaver bone if we have gum surgery many times as we get older. So I really do like Renuva for that reason. The best fat, of course, is me doing a little, now we were talking about non-surgical, but I could do under local anesthesia, a little lipo and taking your own fat. That's the best. I love that treatment. But if we're looking for off-the-shelf type of treatments that are quick, I do feel that Renuva is a great treatment. So I will use it in the temple area, and I also like to use it under the eye, and so I feel very much that is a great addition to our armamentarium. Is there anything that you, and as we're getting near our show, and I want to thank you for being here, is there anything else that you might recommend to patients who are suffering from facial deflation? What should they do?
Well, all the things
besides
that we
call
mentioned.
you. Okay.
Oh gosh, I think addressing the skin, so skincare as well, medical grade skincare, I'm a huge fan of.
Right, microneedling, PRP, which is biostimulatory, all of those things are very helpful.
Yes.
So today we thank you, Mary, who's been with us, is a great injector. If you would like to see her, please just call our office to make an appointment with her. We were just talking about bioregenerative or biostimulatory treatments to help to build more volume in our face for those who are beginning to look gaunt, maybe have had massive weight loss. So we're here to help you, and I want to thank you for listening to us on Ask the Expert, and thank you, Jeff, for having us again.